There's a new research paper out by 2 combat soldiers about combat soldiers and their behavioral health.
It's the first study to show that keeping track of soldiers from garrison to theater and back home results in less PTSD, depression, and other concerns.
Our medical editor, Dr. Paul Little, has been following the story and joins us now from the studio. Sir, what do you have?
You're exactly right, guys. This is a very interesting, very valuable study, and we're lucky enough to have 2 of the authors of that study here with us today, and they are Dr. Chris Warner. Dr. Warner is a family practice physician and also a psychiatrist, and he's currently a schoolboy at the Command and General Staff College at Fort Leavenworth. Dr. Warner, welcome to you.
Thank you, sir.
We also have Dr. Ned Appenzeller. Colonel Appenzeller is commander of the U.S. Army Medical Activity in Alaska at Fort Wainwright. I believe that's correct?
That's correct.
Now, Chris, I'd like to start with you. This study was done back in 2007, right? And you started at Fort Stewart, and you had 6 brigade combat teams. 3 that had trained with you all at Fort Stewart and undergone the training that you guys put in place there, and 3 that came on board as also under the control of the 3rd ID. Tell me what difference there was between those 2 groups.
Yes, sir. All soldiers receive pre-deployment screening before they deploy. What was unique about this process was we wanted to build a bridge between behavioral health care soldiers were receiving at home and the care they could receive in theater, and ensure that we kept them engaged so that we could support those soldiers and set them up for success.
Now, you did that because the brigade combat team surgeons at Fort Stewart actually deployed with you, and then they took care of those soldiers in theater. Is that correct?
That surgeon, as they went to combat with them, would have the information of what care that soldier received, what their needs were, so that they could provide that and also coordinate with the in-theater resources to make sure we were taking the best possible care of those soldiers while they were downrange.
Okay. And Dr. Appenzeller, expand on that a little bit for me. I still don't understand did you take the DoD standards that were already in place in 2006 and modify them? Did you add to them, or what, to do this study?
Well, we didn't change the standards. The standards are the same across the Army, and all pre-deployment screening sites use the same standards. What we did was, just like every primary care provider in the community, civilian community, and the Army back home, we took what we did there and ensured that there was continuity of care, that our soldiers, primary care providers, the PAs and the doctors going to Iraq with them, had a plan for each soldier to ensure that the care did not drop off, and that we were proactive in keeping the soldiers engaged in that care.
The unit surgeons are with them when they're at home and throughout the ARFRGen cycle, throughout the deployment cycle. And we can make sure that we provide that information and link them to those services. And that brigade surgeon was able to track that information and work with the in-theater medical and behavioral health assets.
This was about those soldiers who might have some issues along the line, ensuring that those issues were proactively cared for and making sure that they were safe and successful during their deployment.
We're almost out of time, but I'd like to just take this opportunity to thank you for your research. People don't realize that you both have full-time jobs, but yet you take the time to do this research that really helps the soldier in the field, and that's really what it's all about. So thank you for what you do for the Army. Thank you for what you do for our soldiers.
Thank you, sir.